Okay, we're good.
Okay. So my name is Courtney Iida. I currently am in Georgia. I am a registered nurse. I'm going on about 3 years now. I've been in the ICU for all 3 years. Come this past January, I actually started a position in the pediatric ICU as well. So I have both pediatric and adult experience. I work at both my ICUs have been at large regional hospitals. So we have our pediatric ICU is a 56-bed ICU. And then my adult ICU is 32 beds, so both very large. And amidst all this COVID stuff, it's just been crazy. We have our unit, we're not seeing it as much in the kids, which is good. So, I mean, I think in total, since all this started, I've only seen maybe 6 to 8 kids positive for COVID. So honestly, not a whole lot has changed in the pediatric world. They've done a little more when it comes to PPE and stuff like that. But other than that, they're responding well to just like basic ARDS treatment. But in the adult world, that's a whole nother ball game. Most of them have not, the ones I've taken care of specifically have not responded to like a basic ARDS treatment, like the typical ARDS. They show with like the pneumonia, the perfect pneumonia x-ray, you know what I mean? And I think it's cool because right now, our ID or IP, infectious disease infection prevention, they take a good control over it. So they're our intensivist's main go-to. They come and physically test all our patients. They create like the standard, we now have like a standard COVID-19 protocol that is initiated once their tests come back positive. And they do, the ID doctors determine if they're up for a trial. Like I know I'm at a big research hospital right now, so they're doing a lot of trials. So they're determining if certain patients can be a part of these trials or not. They determine whether they're able to take, the hydrochlor, whatever, the long word. Right. Which honestly I haven't seen it used a whole lot with our patients in our ICU. But I do know I have a few friends who that's like their go-to treatment in their ICU. So it's very differing when it comes to that medication, at least from what I've seen. But yeah, I mean, treatment-wise, they get put on a couple antibiotics. They do tend to want electrolytes a lot higher, so we've had to change that. So like now your electrolytes they expect their like potassium, they want it from like 4 to 5, whereas our initial replacement goes down to like 3, 2. So now we're replacing when it's all the way still up at 4. And same with like mag and phos, we keep those much higher than like the standard replacement. And we started a new thing because I don't know about Colorado, but in Georgia, a lot of like our acute care floors are like empty unless they're COVID specific. So we've done, and our ICUs are so overwhelmed. They've done what's called team nursing. I don't know if you guys have started that in Colorado. So I've been a team lead, and then I get paired with a critical care APP. And then we usually have 2 to 3 acute care nurses under us. And then we like delegate to them. They've been cross-trained to a certain degree, but they do like the little things that will just help take it off of me. So they do like mouth care, and they monitor like the urine output and all that kind of stuff. And they can do things like under my direct supervision and like direction. So like we've done this like monitor system. So there's monitor inside the room and outside. And you like talk through the monitor because they're really trying to like minimize PPE use and how many people are in and out of the rooms and stuff. So if they're in the room and their pressure starts dropping, I can physically tell them like, hey, titrate the levo to this. Or if they're getting wild on the ventilator, I can be like, hey, bolus them with this and stuff like that. So that's actually been pretty helpful. And even they can do things as far as like on CRRT, they can change like my effluent bag and dialysate bags and all that. So just like little stuff that you don't realize actually takes up a lot of time. So
right.
Yeah.
They are definitely acute, the patients you're taking care of. And
yes.
So have you guys done the proning?
We've done a lot of proning. And honestly, I would say thus far, that has been one of the best, like the most successful outcomes for us is when we've got to some of them where they come in and we're just like prone them like from the start. Some take a little time for us to decide on that. And honestly, it's a new experience for me because I've done the rotaprone I have experience with rotaprone, but I have never like physically manually proned a patient.
Right.
So that's been different and took some time to like just get the hang of it, but we do it so much now that it's pretty interesting.
It's a very different type of care and I've only taken care of one patient that we ever proned when I worked ICU, and it's a different approach because you're not able to look them in the eye quite as well, and it's just different.
It is. So, yeah. You have to cover all of their bony prominence, and it's just they're covered in protective little foam pads and stuff. It's just so different.
Very interesting. Yeah. How is the morale? How is the teamwork going?
It's going better than I thought, especially I know people struggle with the fact that things are changing daily, hourly, you know what I mean? Between like patient treatment, how we're treating them, what we're doing, and then just to like basic hospital policies now and all that. And as much of a like downer as it's been very good. It's been very good morale, and people are hanging in there and they're helping each other. And especially the ICU with it already being a stressful environment. I feel like this is just taking it up 10 notches, but it's been really good.
Right. And so they're basically taking the units that would be sending the nurses home. Those are the ones that are becoming part of your team, right?
Yeah.
That's good.
Yeah.
Now you are in such a large hospital. You're still, I'm sure, seeing trauma patients and things, right?
We are.
In the ICU?
No, they don't stop just because of COVID.
I know. It's like that doesn't work that way.
Yeah.
And so are they separated? How do you manage that?
So it's like the ICU is like a perfect square or rectangle, I guess. And then half of it is negative pressure, COVID only. And then this side, we had to like take half of that side to do COVID as well, just because we were getting so many. Wow. And then the bottom, like I think 5 or 6 are reserved for traumas.
That's good. Interesting.
Yeah. And they try to do like our trauma team, if they haven't had to, they won't take a COVID patient.
Yeah. Right. Try to keep them separate. That makes sense. Sense. What has been the biggest challenge for you? 3 years, you learn a lot real quick in the ICU, but
you do.
What has been the biggest challenge for you? Still kind of being a young nurse.
Yes. Oh, yes. Honestly, for me personally, my biggest thing has been not to just like rush into the room when something's going bad. Like taking the time to get all that PPE on, to really like make sure I'm protected before I go in. Whereas like when I normally see an O2 dropping into the 70s, you haul in there and figure it out. But so that's been hard, especially because like our PPE, we have like those white bunny suits. So you have to like zip it all the way up, get your mask, get your goggles, get your face shield, all that. So that's honestly like putting myself first. Like you need to be safe. You would take care of these people. So get dressed right, like take the 3, 4, 5 minutes, which doesn't seem like a lot, but when someone's decompensating very rapidly. Like that's a lot of time.
It does. It feels like forever.
Mm-hmm. And kind of just like the changes, like now if they're already on a ventilator, usually like when they code and stuff, you take them off the ventilator and you bag, but they're just trying to prevent all possible aerosolization. So they keep them on the ventilator and they do their best to like manage it through the ventilator, whether it's like O2 flushes, rate change, peak change, all that kind of stuff. But that's hard to do when it's not working, like, you know what I mean?
Right.
What else? And yeah, and I just like the changes, I think would be the hardest thing. Like now our intensivists don't intubate. We have the anesthesia team. They come and intubate.
Okay.
Which is kind of cool because then it just takes like less people out of the room. But, so yeah, it's like the anesthesiologist comes up and intubates, and then the CRNA does sedation meds, which is different because that's usually what we do. So during intubation, I almost feel useless. I'm like, I'll just stand here and watch.
Yeah, interesting.
But it's good because they have like, I don't even know what they're called, but like the big helmets that like constant negative pressure and stuff. So they're just much more equipped for an intubation, safe intubation like that.
Right. Because of that aerosolization, that's the big fear on that.
Yep.
Absolutely. What, how has it been regarding visitors and not really lack of visitors? And how is that?
There's definitely two sides to that. Like personally, as a nurse, especially on night shift, it's nice. It's just one less component to it all. At the same time, it's emotionally, I think that's been like the biggest hit is where like now we have patients dying alone, or if they're not doing well, we will FaceTime the family. But if they're already intubated, already sedated, they can see them, but they can't say much. So that's been hard, especially in those instincts. Like you never want to see anyone die alone. So as a nurse, I mean, when it's my patient, I like take a little more time. I'll like just sit there with them and I'll hold their hand and stuff like that. Just so like whether they're sedated or not, I mean, I would just hope in the end somebody would do that for me if this was my situation. So that's where it gets like sad when it comes to visitors. So.
Absolutely.
Yeah, and we've had a couple of like husband-wife situations where they both get sick and they're both in the hospital and they're like just FaceTiming each other to their rooms and stuff. So
interesting. Do you have some positive things that have happened? Whether it's to like as the hospital as a whole or just with different individuals?
Yeah, we've definitely lost more than discharged, but we just recently had about 4 people get discharged, and the hospital plays like a fun song overhead when they're leaving the ICU. And it's so cool to see like how emotional they are about it, like leaving. Like, I mean, I'm sure there were times where they didn't think they would leave, you know? So to see them so like uplifted and so happy about it, I mean, it just goes to show that like your hard work pays off. And the community has been phenomenal. Like everybody sends us food. Everybody sends us like, we went to a policy where you have to wear masks 24/7 in the hospital now, like anywhere you go. So a bunch of people have sent masks in for us and stuff like that. So other than the patients that physically get sent home, I think like the biggest positive about all this is just like the actual community, like rallying behind nurses and healthcare and all that. And I think it just like gave the healthcare respect that it's kind of been lacking for a little bit. Like I think people are truly seeing like what the healthcare system goes through in, day out. So I think that will be a positive in the end.
Right. What do you think will change because of this regarding healthcare?
Ooh, that's a good question. I hope that, I mean, like I said, I can't speak for every hospital. I can't speak for other places, but like, I just hope that in the end, like management takes a little more time to help their nurses when it's needed. I don't think it should take a pandemic for them to see that things need to be changed, but it has. So I hope it does. And I just hope that in the end, like, we're more prepared. Like, I don't think no one was prepared well enough for this. And I don't know if you could have been. Like, I really don't know if you could have bought a little more PPE from the start, had a little bit more backed up and stuff like that, or just being ready. But I hope now to see what it takes to, like, work through a pandemic, they're a little more ready if something were to come with this again.
Right. How about your education? I can't imagine personally how to ever prepare for something like that, but truly what could have prepared you in all your education?
Ooh, I don't really know. I don't really necessarily know if there could have been educational wise. I don't know if anything could have changed or better prepared me, but I think just like we need to learn and be taught, like, you just have to be flexible. Like, you may have this protocol, but it's okay if they tell you this, or, you know what I mean? Like, just really having to go with what's coming at you and how things are adjusting, and which I think nurses do a good job anyways. Like, I do feel like, especially in school, they're like, this may happen, but it's not the only way. Like, you know what I mean? You just need to go with the flow sometimes.
Definitely. Yeah. Ever changing you got to make do again with the whether it's lack of supplies or literally having very different supplies. You have to adjust to that.
Yeah. We've had to have many in-services, like quick on-the-spot in-services for things that we either replaced something old or like ran out of something, so they brought a new type in or something like that. So just very on your feet about it all.
Right. Interesting. How is your family dealing with it? You just got engaged, right?
Yes, we did.
Congratulations.
Thank you. We've been good. He works for a pharmaceutical company, like in the lab aspect, so he's still considered essential. So our routine wise hasn't changed much because we both still go to work and all that. But I can tell, like, my mom and my brother and all them, they're like struggling not seeing us as often and all that. But I personally just wanted to be a little more cautious because I am in a COVID unit. So but overall, not a whole lot has changed. We've been good. He's definitely like, he keeps me sane though. He's my little shoulder to cry on, ear to listen to. He will hold the house down while I'm gone, that's for sure.
That's good. How do you cope? What are some of the coping strategies you use when you're not working?
I'm a big self-care kind of girl. I love a good face mask, glass of wine, hair mask, all the 9 yards. I love sitting on the back deck and reading now. It's nice to just be in the sun sometimes, especially on night shift when you're usually sleeping during the day.
Right.
We take our long walks. And we're in a pretty quiet neighborhood, so it's really nice to just walk and hear the birds and just kind of not think about the night or day that you had. And just, I like to think that I leave it at work and come home and can decompress really good and just kind of like forget about the night. Some are harder than others, obviously, but for the most part, it's just like really focusing on myself and doing what I enjoy, even in quarantine. Like, you can't really go places that you usually go to, but
right.
Right.
That's great. So without getting too crazy political, how does the hospital and your healthcare coworkers feel about the different recommendations regarding quarantine and being out in the community? And
so as most know, Georgia opened on Friday. The state reopened. Healthcare, I think healthcare wise, we do think it's too soon. We were like, what's another 2 weeks? Like, we've already been in for, I don't know, about a month, give or take. Like 2 more weeks, I don't think would be an end all be all, but I understand like the economical standpoint of it all. And I just, the hospitals, they created this team nursing, especially in case of like a second surge, or, I mean, personally, other than like the initial wave we got, I don't know if we've even hit a surge yet. We've kind of just had like a steady steady stream of them coming in. Like as of right now, we haven't been like crazy overwhelmed. We haven't felt like we're not prepared yet. We do have 3 COVID only ICUs though. So it's pretty big. Like we have a pretty big population right now. But it's definitely, I would almost say the state seems like split. Like a lot of people are ready. They think it was a great idea. And then there's still a good chunk that are very reserved about the idea and are still planning to stay in or social distancing to the best of their ability and stuff. So I'll be interested to see what kind of happens in the next 2 to 3 weeks with people. Because even right now, like I know we opened on Friday, but I still haven't seen, like it doesn't seem like we've had an influx of people out yet.
Right.
So I think people are still kind of being cautious. So we'll see in the next few weeks when they do start to come out if we see maybe an increase of just like sickness in general. Like when you're quarantined and not socializing and excessively cleaning, I mean, you're going to lessen your immune system. So introduce more people and then who knows? Well,
it'll be interesting.
Yeah. Well,
I was just thinking about the kids that you said in the ICU. How is the visiting going with that? Are they allowed to have like one parent with them, or how does that piece work?
Yeah, they're allowed to have one caregiver at the bedside. They can switch in and out as much as they want. So like mom and dad can come and go. They do screening of all of the parents. They get a temperature and like a questionnaire they fill out, and they have to do it every single time, even if they were only gone for 2 hours or whatever. They have to rescreen, and they get these like specific badges that indicate that they're like the primary caregiver. And then they'll just switch it out with each parent when they come and go.
Interesting. Yeah. And are they wearing what kind of PPE do they wear?
So it depends. If the child is COVID positive, they quarantine in the room with the kid. Like they can't come out. Thankfully, there's full shower bathrooms in there for them. They get the meals delivered from our food service and all that. And we encourage them to wear a face mask. And then if they are doing some sort of aerosolizing procedure, they put the mom or the parent in the bathroom in hopes that all the negative pressure rooms will like de-aerosolize before that they come out of the room. But other than that, that's all they need to do. They're not allowed to like hang out in the waiting room or anything like that. Like if they're not leaving, then they're staying in the room just because there's nowhere to go right now. But they don't have to wear anything if it's not a COVID positive.
Okay, interesting.
Which has been interesting because other than like a select few, every kid we've had COVID positive has had parents positive. So
right, you would think. How is it working in that PPE?
Oh man, it is the worst. I will be the first to admit that. You sweat like it's nobody's business. It's so hard to breathe just because the N95, and it's exhausting. My poor skin's taking a hit just like with the mask on all the time. And I don't like things on my head, and we're required to wear surgical caps. So I just feel like I'm watching my head because I don't like things on my head. And it makes the job harder for sure just because you're so hot. But we've just cranked down the patient's room, especially since there's no visitors or anything. But yeah, it's a workout in itself.
I believe it. I just saw an article this morning that came out about all the complications of wearing the N95s all day long, and that we have to be careful of our healthcare providers who are doing that because they can be dangerous.
Yeah. I was like, you guys don't have to take my blood gas to see what my CO2 is after this.
Exactly. That's crazy. And how long are you in so you wear it in the room? Are you wearing it on the units then too?
No, they want you to, their thought is, since the rooms are negative pressured, that it shouldn't necessarily be in the hallway.
Okay.
So all they expect us to wear like outside of the rooms is just like a basic surgical mask.
Okay. Well, that's good. That's good.
Surgical mask and then a scrub cap all the time.
Interesting. Crazy.
Yeah,
And you still have long hair, so
do this.
Yeah.
But so yeah, we're usually in the room. They're very big about cluster care. So I mean, usually in ICU especially, you have something like almost every hour, it feels like. But they're kind of doing more of like a 2 to 4 hour time frame. So as long as it's not like a strictly scheduled med or anything, they're like do everything from about like 8 to midnight med wise.
Okay.
At about 8 or 9. And then do like your 8 to 10 stuff like at 9. And then that way you're not really going back in until whatever time. But it's really nice because at the hospital, my big adult ICU hospital, we have what's called an EICU. So it's an electronic ICU. So that's been super helpful because they're watching our patient all the time. So, if something's happening that we may not be seeing right away, they just call us and are like, hey, I think it's time that you do need to go in. This is happening or whatever. And it's also helpful now because they're physicians running our codes. So like it's less people physically in the room. And since they're monitoring the patient all the time anyways, and they know everything and they have access to the chart, it's not like we have to catch them up in the midst of the chaos of a code. They just kind of jump in and get going, which is really nice. It lessens the people physically in the room, but yet you still have that authority physician figure there with you.
That's good.
Yeah.
Good. Yeah, that's a huge piece to lessen how many, a regular code, you could have 15 people in the room.
Yes.
So definitely different.
Yeah, and that's another thing they're very strict about. Like, it's the primary nurse, one RT, depending on the situation, either your physician or the EICU physician, and then like pharmacy and all that has to stay outside the doors, and they just pass things in through this little open window thing we have.
Has there been remodeling to the ICU rooms? Like have I know not full on remodeling, but have you readapted the rooms to meet the needs?
Thankfully the one I'm in now was recently like fully remodeled about at the very, very end of last year. So it worked out well because they were put somewhere else and then we moved back down in January or February.
Okay.
So then it just worked out very well. And the rooms are really big. So like it fits all our machines now and you're not climbing through and over everything just to get to the patient. But so it's been, and I think the biggest, it's pretty much a baby monitor, but they keep one inside and one outside. And then you talk through that for like the things you need and stuff. So you're not coming in and out of the room.
Perfect.
Yeah.
Do you think would it have impacted you at all in your decision to go into healthcare?
Ooh. I don't know. I think if I knew what I know now, not like trying to start, I think I might have held off. Like maybe not like hold off of nursing altogether, but like just like starting, like, you know what I mean? Like, I don't think I would start in a pandemic.
Exactly.
But yeah, I don't know. Maybe not.
Yeah.
It's definitely cool might be a bad word, but it's cool to say that you've been part of the pandemic and that you're kind of shaping what will happen and all that kind of stuff. That part's very cool and like very honoring to be a part of it. But I don't know if it's cool enough for me to start in a pandemic.
Right. I find it, I've had people kind of thinking of this back to like 9/11 when we had a lot of people decide to become firefighters and join the military. Are we going to see more people joining healthcare or are we not?
Yeah.
Interesting.
That's a very good point. I definitely think people will. But they always kind of say like ideally in your lifetime, you only live through one pandemic. So
Exactly.
let's hope.
Exactly.
But yeah, but at the same time, it's as good as the teamwork is, everybody's so busy that you're also kind of on your own for a lot of things.
Mm-hmm.
And I know that would be very, very scary for me as a new grad.
Yeah, so absolutely.
Definitely see both sides, like starting and not starting.
Mm-hmm. Has your hospitals, or even just you guys as nurses and healthcare providers, have you guys found a way to debrief together? I mean, you're so busy, but has there been time for you guys to debrief on the job?
They're very good about huddling, which I guess to a certain, so we debrief after every like significant episode, which is very helpful. And I think it's important because a lot of hospitals don't do that, or like a lot of people don't do that. Whereas like our physicians are very strong on like, once everything's settled down, you got whatever was going on taken care of. Like everybody's outside your door and you debrief for a good like 10 to 15 minutes about what led to the event, what could we have done better during, what there was a code, what could we have done better, all that kind of stuff. And I think that's very helpful. They have like a little sheet that they kind of guide through and then we'll just pretty much, like you said, debrief, like this went well, you really communicated this well, this needs to be worked on, like this impaired something, or you know what I mean, that kind of stuff. And then they've done really good during this whole COVID situation to where we huddle twice, morning and night, before each shift, but it's more so focused on what we've either done the shift before that the next shift needs to be aware of, or changes that have happened and stuff like that. I just think they've taken it a step further than like the traditional huddle. Sometimes our huddles, to be 100% honest, are useless, but they've done a lot better job about making them very informative, related to like the topics we're going through, and I guess helpful, like you know what to expect coming on to shift and stuff like that.
Right. Yeah. That's great. What would you want history to know about this? How do you want this to be known in history?
I mean, it's like I'm very torn about it because I still personally don't think we know enough about the virus for like the virus itself to be like the history standpoint. I think it needs in history more so like the rallying behind everybody, like the whole, I just feel like the world put their focus on healthcare and like supported them and all that. And I think that in itself is so important because I mean, like a lot of people said, like there are other diseases that have caused more deaths than this COVID. But I just feel like it took this for people to realize that like there's obviously a few tweaks and turns. Like we do go through this like on a daily basis. Like this isn't, other than the PPE and some abnormal treatments, like it's not far from what we do on a daily basis, at least in the ICU. Like I know it's affected other areas differently and stuff. But from that standpoint, it's like I think is just like the biggest thing history is like, it shouldn't necessarily take this pandemic for like the world to come together. You know what I mean? Like in this, especially with like the election coming and all that, it's been a very, very like divided country. So I think it's a good piece for people to see that like amidst everything political and all that, like we still can agree, we still can come together.
Right.
If we don't agree, then we can agree not to agree. Like, you know what I mean? Like, and I feel like that's a big thing that we've missed as a country in a little bit, is that it's okay to agree to disagree. So I'm hoping that this has shown that like as a nation that we can come together and get through a lot.
That is wonderful. Thank you so much, Courtney. I really appreciate everything you've said. It's been wonderful.
Absolutely. Thanks for giving me the opportunity.
Yes.